All right, we'll call this Insurance Committee meeting to order. At this time, I'd like to ask everyone to please stand for the pledge and remain standing for a moment of silence, please. Mr. Bergeron? I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, welcome to our April Board Insurance and Finance Committee meeting. We'll call the roll at this time.
Mr. Bergeron,
Present.
Mr. Edmond, Mr. Hidalgo,
Present.
and we also have Mr. Lejeune here that is sitting in. You have a quorum.
All right. Item 2.1, review and approval of the Lafayette Parish School Board Insurance Committee meeting minutes for March 18th, 2025. At the appropriate time, I'd like to ask for a motion to approve.
I make a motion that we approve the minutes from the Board Insurance Committee meeting on March 18th, 2025.
And I second that motion.
All right. Motion and a second. Is there any public comment on the approval of the March minutes? Hearing none, Madam Secretary, please call the roll.
Mr. Edmond?
Yay.
Mr. Bergeron?
Yes.
Mr. Hidalgo?
Yes.
3 for, none against.
All right, motion carries. Item 2.2, discussion and or action regarding the Gallagher report. At this time, I'd like to call up Gallagher. And of course, Ms. LaBeouf, if there's any part of it that you need to, come on up.
Good afternoon, everybody. Again, my name is Melody Terrell. I'm with Gallagher. I have Kim Briard. I think I'll kick it off and then pass it on to Kim.
I'm sorry, 1 second.
Yes.
Just one thing I forgot to mention. We're going to do the same thing as we've done before. Anyone from the public who has a question, we have a notepad on the podium in the back. We ask that you, for the questions that you have, please go up to the podium. We need your name, we need your question. And before the meeting's over, before any votes are taken, should there be a motion, we'll address those questions. Thank you.
Okay, thank you. Okay, so on our second page, we have an agenda. We'll talk about the plan performance thus far. We'll talk about a projection, the actuarial projection. From that projection, we'll give you some what we call premium equivalent rates, which is basically the board portion and then the employees portion. And then we'll talk a little bit about the initiatives that we have on the calendar that we think will create cost savings, and then the annual service calendar to give you some ideas to how we'll kick that off and complete those projects. A little bit about the plan performance. When we talk about all plans and all classes, what we're doing there is we're taking into consideration the averages of your actives, your retirees with no Medicare, and then the retirees that are over 65 that do have Medicare under the self-funded plan. Currently, the plan is averaging $516.94. That's per member per month. When you compare that to the previous 12 months, because the $516.94 is actually claims from July through January. But if you roll that back and add in a total of 12 months, the plan was running $527.27. So you can see that we're actually running a little bit better than we were compared to those previous 12 months. The actives are averaging $525. The retirees with no Medicare are averaging $913. That category of individuals always on an actuarial basis are your most expensive claims. They have no Medicare, so Medicare is not paying first and then the plan paying second. When you look at your retirees over 65 on the self-funded plan, you can actually see that they're running well. However, they are a high-risk category where we worry about the end stages of life and the specialty drug medications that can be attached to that risk. We look at it a few ways. So we look at the high deductible plan. You actually offer 3 plans to the employees, and they get to choose from those 3 plans. The high deductible plan is the lowest cost plan to the employees. Then you have a basic plan that you offer to the employees, and then the enhanced plan. The enhanced plan is more expensive. When you look at the high deductible plan, it's running $396. That's, as we would assume, there's no first dollar coverage. The basic plan is running $797, and then the PPO enhanced plan is running $951.
You have this listed as per member per month, but does that include just medical claims, or does that include prescription drugs?
Thank you. It's medical and prescription. All right. One thing that we like to point out here is, although we said that the plan is running in this last period from July to January less than the previous 12 months, we do have to worry about inflation. You know, inflation is the cost of medical goods and prescriptions. It's influenced by factors such as advances in technology, increased demand, rising labor cost. So when we think about where we are right now, we know that from an actuarial projection, that's not where you're going to be next year. You know, there is an increase in healthcare, and it is outpacing normal inflation. Currently, the national trend factors on medical are 7.5%, and on pharmacy, it's 13%. This is the part of healthcare that's making it so difficult for employers to sustain, is the inflationary cost. Okay, the next slide is a projection. This comes from our actuarial department. Instead of reviewing every aspect of how actuaries come up with the projected costs, feel free to ask any questions on the left-hand side with these categories of how we come up with what we think the future cost is going to be. I can certainly answer them. But I think the ones that are the most important are your gross claims paid and the rebates and the specific reimbursements that you get to subtract from those claims in order to come up with a future cost. Again, all of this data of what has been paid has been increased by trend, because it would be fiscally irresponsible to not project what everybody believes is that inflationary cost of medical care, along with the prescriptions. At the end of the day, when you look at your claims cost and your fixed costs, which is off to the right, we're projecting increases in those categories as well. On the fixed cost basis, we're saying that we believe that the annual fixed cost number will go from 8.4 million to 9.1. When you add that to what we project the claims to be, we're saying that the plan is calling for a $69 million budget. Currently, you're funding at $57 million. You made a general fund transfer of $6.4 million. Or what you have funded for is $63 million total, which again calls for a 9.6% increase. There's a couple of ways that we can attack that number. One is that the employer funds more money. The other is that the employees fund more money. And the other is what we call plan changes. And we're going to talk about ways in which we believe that we can tackle that inflationary cost or that increase in the budget.
Two favors. Number one, it's 69.995, so let's say 70.
Sorry.
Let's not say 69. And
Okay.
Committee members, even if you already know this, I just want to repeat what Ms. Mellody just stated. There are only 3 ways to attack our budget and our plan, and that is to raise premiums on the employees or the members, to increase the funding from the school district, or to reduce costs and plan changes. Now, The plan changes, I know you're gonna talk a little bit about, but just to put it into perspective, I mean, there's 24 things that can be done regarding plan changes, and they're already working on several, as you guys well know, and hopefully you'll have something to report on that today, but the right-hand column there at the top, where it says fixed cost, just to be clear, and Mr. Bazeron, I think you and I talked about this before, these are, well, what it says, just fixed costs. This has nothing to do with the claims, but Ms. Melody, if you could explain to me, how are you guys coming up with the $70 million? Meaning, are you using claims data from last year, assuming that it's going to be the same, knowing what our trend is here in the system? That's a bad word to use. Knowing what our claims history is in the system, are you utilizing that to then estimate what next year looks like in claims and prescription drug data?
Yes.
Okay. Members, do you guys have any questions, or Mr. Lejeune, do you guys have any questions on this slide so far before we move forward? This has been compacted for us and not, 3-tab spreadsheets, but this is a lot of information. There's a lot of information on this sheet, guys. So is there any questions so far, Mr. Bazeron? Okay, carry on.
All right, what's probably most important is, how do we?
I don't know that it's working. Mo, is the microphone working?
Hello? Nope. Kim's supposed to talk right now anyway.
So I'll, t-
Pass the mic to Kim.
yeah, I'll take this slide. So what we wanted to do here is just, the third item that we talked about is just, strategies to reduce the cost of your program. Those strategies could be in the fixed cost area. We know that that's just a small portion of the overall spend, or they could be in your claims cost, right? Which is where you're going to get the most opportunities, because it's the biggest part of the spend. This slide here just kind of recaps the things that we did that went into effect for January 1st of 2025. When we do account for, in your projection for 2026, we do take into account the changes that you made in 2025, even though, they may not be realized yet because it's just March, right? So over time, we're going to see these things that were decided on impact your claims cost through the rest of 2025. So we wanted to just highlight those, remind you guys of, the cost-saving initiatives that have already been taken advantage of. The first one was the pharmacy contract negotiation with RX Benefits. So just, we didn't do an RFP, we just negotiated directly with RX Benefits and negotiated a cost of about $1.4 million savings just in that contract negotiation. We also negotiated your Blue Cross contract and realized about a $65,000 savings. We implemented 2 programs. One was TRIA Health. It's a chronic condition management program that focuses on pharmacy and clinical programs. We're estimating a savings of about $767,000 from that program. Lantern was also implemented. It's a musculoskeletal program. It drives folks for these specific types of conditions to centers of excellence. And we estimate about $160,000 from that program. There was a dependent audit that was conducted with a savings estimate of $109,000. We're also going to continue to do dependent verification ongoing. New hire Medicare Advantage mandatory migration was not implemented, so there was no dollars there. We did make some minor plan changes to the plan, which realized about an $885,000 savings. And then the biggest part was there was a change in premiums to your active employees and to your retirees that totaled about $2.5 million. So all in all, the things that were voted on and approved for 1/1/25 were right under $6 million in savings and initiatives.
To clarify, those savings that are here do not touch the $70 million recommendation. That is what's already been saved, and your recommended budget for next year still remains at 70 million after those savings. You're just identifying what you saved last year.
Yep.
If they wouldn't have been saved, we'd be at $75 million.
You got it.
All right.
All right, so looking forward, there are many initiatives that we're currently working on today, with the idea of an effective date for January 1st of 2026. So a full pharmacy market check is in place right now. We're estimating about another 2.5 million from that project going to the market and making sure we're securing the best contract terms in the pharmacy space. A full TPA market check is also underway. We started getting results back from the market on that, some very favorable things. But, we're looking at your TPAs, we're looking at your networks, select networks we talked about, last year. We weren't ready to go there yet, but we're going to continue to evaluate all of the knobs that you can pull in your partnership with your TPA. So we have that out right now. Plan design changes are always something that, we're going to evaluate. Your member cost share, what they're paying in their deductibles, co-insurance, co-pays, tiered member benefits are also a trend in the marketplace where we're, again, steering employees to low cost, high quality providers. So there's opportunity there for savings. We continue to look at point solutions, which will attack clinical components within your plan. So we're looking for the high areas of utilization and how do we attack those and try to save from a clinical perspective. So oncology is one where there are center of excellence programs that are available. So we're going to explore those. A Go to Doctor campaign, which is around well-being and wellness, so supporting, just preventative services in your health plan, and then some metabolic management. Also exploring wellness, tobacco, spousal incentives, and HRAs. So spousal incentive HRAs and Center of Excellence HRAs are also, some of the items that we're exploring for 1/1/26.
Members, if you look at Gallagher's document, you see the two columns to the right, 2026 annual estimated impact and fiscal year 25-26 impact. Just want to clarify that their estimated savings here in the middle column, that's on our plan year, not our budget year. And so even though the 2.5 million looks nice, we are budgeting for our fiscal year, not our plan year. And so that's where the last column comes in. So thank you for putting the total for the entire plan year. But our folk, for the purposes of this committee, we should be focusing on the column all the way to the right.
Yes.
Any questions on this page?
So let me just add this in perspective, because whether it be this sheet or the sheet before, when we are looking at the budget that we're going to be adopting July 1, I want everyone to kind of understand their perspective. Last year we had to put in $6 million. We're going to go ahead and put that $6 million into the budget for July 1. What you're saying is that we probably need an extra $5 or $6 million to cover where you think we're going. I am saying to the board that we're not going to put an extra $5 or $6 million because we're going to try to see what we can do by trying to get this cost savings with some of these different things. And what I will tell you is that if we don't do some of these things here, then we're going to have to we have $6 million we already taken out. We're going to have to take another 5 or 6, so that's going to be $11-12 million to fund this particular plan. That is why it's going to be imperative that yes, we're going to give up the $6 million. So I want everyone to know that the general fund will give an extra $6 million to the plan. But they're saying it's not going to just take $6 million, it's going to take an extra 5 or 6. We have to do some of these things. If we don't do this, then we're gonna come back to this table and we're gonna have to start cutting people, we're gonna have to start doing some different things. And I just want us to, when they bring certain recommendations to the full board around plan changes, we're gonna have to take those things into consideration, or we're gonna come out of the budget again with another 5 or 6. So I just want to reiterate that that is why they're presenting this and giving us these options. I am hoping and I am praying that we can get to these savings, because if not, we're coming back out of general fund with more money.
If it's okay, Superintendent, I'd like to just expound on that a little bit. The $6.4 million that was transferred last year, that's going to be transferred again this year, is already unacceptable enough. We talked about this last year. We have to find a fix for that. But now it's been compounded with an additional $6.2 million. Now, again, I don't think we're going to realize that. I think what you see on this document in front of you is they're going to come back with substantial potential savings. But I just want to, even though it's a little premature, you could say it said first here, some of these decisions are going to be tough decisions. We're talking about some disruption when it comes to pharmacy, potentially some disruption when it comes to medical. So, the conversations always start off with money, and then they end up with real human beings and real lives. So our decision is, do we just keep throwing more money at it? Or do we try to do something different? Because we keep doing the same thing over, expecting a different result, and you know what the definition, you know what the term is for that. So it's going to be tough when it comes to some of these changes. I mean, I can see right now, direct contracting, select networks, just the pharmacy check, there's going to be some disruption. Uncomfortability. Everybody's still going to have access to their medication, but it's going to be changes, and we know folks don't like change. So we're not $6.4 million behind. We're closer to $12 million behind. And even if they do find $5 or $6 million worth of savings, we still have to try to find out how to get rid of that $6.4 million that we keep transferring to the general fund, because I do not want to see us bringing to our employees and our members and our people in this district the ridiculous premium increases it would take to balance this budget. So I'm asking you guys, I know you guys are working hard, but we're asking you, let's take it serious.
Yep.
A couple of things I guess I just want to add is an update to the committee, because we did tell the workshop that we're hoping that the market checks on the PBM and the TPA will be completed by May 28th. These others are still to be determined, but just wanted to give you an update on when that work should be completed.
It's completed by May 28th, so then your recommendation, you're saying will potentially be ready by May 28th. How does that look on our timeline, Superintendent or Finance?
I thought it worked, but I'm glad you're clarifying. I want to hear it again.
Matt, you want to kind of comment on that in reference to the budget?
Our budget meetings are scheduled. I think the 2002 tax, I don't have the calendar, is our May 7th budget meeting that we bring that one.
Yes, sir, May 7th.
We have talked about, and I think what we're going to propose is going to follow what the superintendent recommended, that we're going to convert the 6.6 into premium and pull that into the general fund. That will do a couple of things. It will help spread that premium. Right now, the general fund is shouldering 100% of that premium. This would at least share it with grant funds, Title I, food service, other funding sources where those employees are. We'll be able to pay some of that. So that will actually relieve us a little bit. We're waiting for those numbers from y'all and from Trish's department to be able to put that together. But our assumption will be that we're going to save the difference. And then as the year goes on, we'll see how that fruition comes out. Rather than trying to go and cut $6.2 million from the budget and reduce a program or do something at a school that maybe didn't need to be done, because the cut is that it's actually 4, not 6, or something in that range. So we're preparing more for an after, because of the chicken and egg situation we have, to do something after the fact with a budget revision.
Okay, so I'm sorry, I need clarification. I want to speak specifically and only to the timeline. A significant portion, potentially a significant portion of savings will come from the TPA market check. They're saying that they expect it to be completed and their recommendations to us on May the 28th. How does that work with our budget timeline? Because that is going to be a significant, potentially a significant impact to what we have to do.
Right, we're scheduled to adopt the budget in May. That's when we come back with a final budget, and then that has to be advertised, and then we adopt it in June, I believe June 11th. I don't have the.
June 12th.
June 12th. So, once that happens, well, once we adopt in May, it gets put out for a public inspection. We normally don't like to change it after that. It can be changed in the June meeting, but we can always revise it in the July meeting or whatever we find out as time comes, as things roll out.
So what you're just saying, Matt, is that we're going to continue with schedule, and if we see these savings taking place, we'll make the adjustment in July.
Yeah, we can make it in June or we can make it in July,
Yeah.
Depending on what we see and what's
Okay.
coming out.
And we do have those rates for you tonight. Taking the 63 million, which is bringing the 6 back into the budget, and going through the schedule on each bucket of where those funds are coming from, and then at the employee level for each classification, right? So understanding, the employee contribution is remaining the same, spreading out the 63 million in each classification. So you have your total rates and then how much is coming from each of the funding mechanisms.
In the appendix, we do have the 70 million, but we have this in the deck, ready to go.
I know there's been a lot of questions in the past from committee members, even on the last board, on why our timelines are so tight. Why what are we doing wrong? And we're not. I mean, our plan year is January to December, and our fiscal year is July to June. And so by the time these claims come in, and by the time all the data gets presented to us, this is where we are, and these decisions have to be made. People have asked, well, why are we always having to make these decisions at the last minute? Because that's when we have the data. And, I've asked, can we change our plan year? Can we change our fiscal year? And the answer's been, we're not gonna do that. But, so that's what we're up against, guys. And so just keep that in mind. This is not we're just gonna hurry up and do this at the last minute. This is, we can only work with the data we have, and we have to have a budget approved for July 1. So that's why we're running on these timelines.
And just to add to a comment that Jeremy just made, the insurance industry, the provider industry, recognizes deductibles and co-insurances on a calendar year basis. So even if we changed, they don't change. That concludes our presentation. You may have lots of questions, need clarification?
Yeah, just clarify what last fiscal year's total was. We're looking at 70 million last fiscal year, which is very difficult to answer, but I know that you're going to give us a very, very close number.
Are you referring to your funding or your plan?
The plan, all included, medical and pharmacy. I want to compare the $70 million projection to,
Yeah, so I think that number was 68 million for the last fiscal year.
okay.
Yeah.
Well, that was your recommendation last year, even though I understand we didn't take all of your recommendations. That was your recommendation. Where do you think we're going to end?
Where we think you're going to hit?
End.
End. Oh, the year.
I think it's 68 million.
Okay.
I think it's going to be pretty darn close.
Pretty darn close to the
Okay.
projection.
They appear to be done with their presentation, so members or Mr. Lejeune, are there any questions
guess just one more thing I want to add, because everybody's, everybody's concerned about what can we do to help control the cost. What you saw on those slides, where it says to be determined, we will continue to bring back these initiatives on a regular basis to the workshops and to the insurance committee. So I got 2 updates today. I'm not willing to share them with you because we haven't validated the numbers. So a lot of the initiatives are trickling in, and we'll be able to, every single month, give validated return on investments so that you can see where you sit.
Can you let me know as soon as you find out?
2 look pretty good, but they're not validated, and we just can't share.
Yeah, no guesswork.
No
We've-
guesswork.
We've,
That's why our budget was so close to where we think you're going to
we've
end.
accidentally done that in the past, so we're not going to do that
Right.
anymore. Mr. Bergeron, anything at all? I'm good. Oh, jeez. No questions? I'm good. Okay. Thank you guys very much. There's not, do we have any questions over here? All right.
Okay, thank you very much.
Thank you very much for being here. With that being the last item on the agenda, this meeting is adjourned.